Greetings everyone. First, I would like to say thank you to all participants who we, SGD B3, could present our paper titled Cerebral Malaria. First of all, I would like to introduce myself. My name is Putu Chandrika Dewi with the last 3 digits number 071. So here are the members of SGD B3 and let's start with the introduction. As well as a tourist destination, Indonesia offers a perfect condition for viral infections to live, such as in a factor like mosquito. The female mosquito bite can lead to some illnesses including encephalitis, dengue, chikungunya, Zika virus, yellow fever, and especially malaria. Malaria is a parasitic infection from the bite of an infected female Anopheles mosquito. In Indonesia, there were more than 300,000 cases of malaria in 2021. This also can lead to some complications such as malaria anemia, nephrotic syndrome, and cerebral malaria. Cerebral malaria is one of the most frequent complications of malaria, which causes severe neurological condition that can induce coma and death. The manifestations of this case in pediatric are comas, convulsion, and severe anemia. Meanwhile, in adults, commonly accompanied with some number of organ problems. Therefore, further investigation is needed to understand cerebral malaria in order to perform early detection, prevention, and reduce the manifestations that may arise. The proper formulation in this paper are what is the overview, epidemiology, etiology, pathogenesis, diagnosis, treatment, complication, prognosis, prevention, and differential diagnosis of cerebral malaria. And the purpose are to give the exact information as the proper formulation. And the last, for the benefit that we hope is to present proper information and a great insight about cerebral malaria for improving its knowledge. Okay, that's all from me. For the next presenter, time is yours.
Hello everyone, my name is Patricia Simpson with the last 3 digit number 1 to 5. Today I'm going to explain the overview of cerebral malaria. So cerebral malaria is a severe neurological complication of malaria that can result in coma and death. The main characteristic is the presence of Plasmodium falciparum on peripheral blood smears. It mostly occurs in children under 5 years of age, and the most affected population are children in sub-Saharan Africa. Patients that survive are very likely to sustain brain injury that can manifest as long-term neurocognitive impairments. The main clinical syndrome of cerebral malaria is impaired consciousness, a coma at least 1 hour after termination of a seizure, or correction of hypoglycemia, and no other cause to explain the coma, and of course the presence of Plasmodium falciparum on peripheral blood smears. Neurocognitive outcome can be improved by combining adjuvant therapies targeting specific mechanisms of brain injury. Thank you.
Okay, hello, I'm Wildan Sifa'ul and my last name number is 174. So now about epidemiology. Malaria is an infectious disease that is a global threat. In 2021, 247 million cases of malaria were recorded in the world, with a mortality rate of 14.8 per 100,000 people. The African region is an endemic malaria, occupies 95% of all the total number of cases malaria cases in the world. Indonesia, as a tropical country, has potential to become a malaria endemic area. And in fact, several regions in Indonesia are recorded as malaria endemic area, mostly in the eastern region, namely Papua Province, West Papua, Papua Barat, East Nusa Tenggara, NTT, and East Kalimantan, Kalimantan Timur. Malaria due to Plasmodium falciparum can cause various complications, of which cerebral malaria is the complication that causes the highest mortality. An incidence of 1,120 per 100,000 per year was recorded in endemic areas in Africa. In Indonesia, cerebral malaria is still often found, even though the national incidence of malaria has decreased.
Hello, my name is Patricia and the last 3 digits of my student number is 171. So now I want to explain about the etiology of cerebral malaria. There are approximately 156 named species of Plasmodium, which infect various species of vertebrates. Humans can be infected by 5 different species of Plasmodium, namely Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax, Plasmodium malariae, and Plasmodium knowlesi. Cerebral malaria is a mosquito-transmitted infectious disease that is caused by Plasmodium falciparum. Plasmodium falciparum is the name of the species that have Aconioidacida as the class, Eukaryota domain, Plasmodidae family, Hemosporida order, and Apicomplexa as its phylum. It also has a homotypic synonym known as Plasmodium laverania falciparum. It is noted that Plasmodium falciparum is recognized as the most dangerous species, being the leading cause of mortality, particularly among young children. It can lead to coma and death, and those who survive may experience enduring neurological consequences. Malaria is not contagious and cannot spread from one person to another. Malaria commonly spreads by mosquito bites from an infected female Anopheles mosquitoes. The only mosquitoes that can spread malaria are Anopheles, and they must have previously consumed blood from an infected person to become infected. That's all from me. Thank you.
My name is Dewi with the last three digits of my student numbers are 146. Cerebral malaria is a disease characterized by the disruption of the blood-brain barrier, a crucial structure that regulates ion and nutrition transfer to the brain. The blood-brain barrier, made up of endothelial cells, serves as a major barrier between the central nervous system and the blood, preventing harmful chemicals from flowing between the circulation and the parenchyma. Disruption of the blood-brain barrier can lead to bleeding and neurological abnormalities, with vascular dysfunction being the major hallmark. The disease is characterized by increased level of endothelin-1, TNF, and IFN, which activate the endothelium, causing increased recruitment of red blood cells, leukocytes, and platelets.
My name is Komang Mahottama with the last three digits number 221. The clinical sign of cerebral malaria is loss of consciousness, and the most severe manifestation is coma. It is thought to be due to parasite cell or PRBC secreted into the cerebral microcirculation, but other authors attribute the loss of consciousness to metabolic factor and inflammatory mediators. In African children, coma develops suddenly and seizures often begin after 1 until 3 days of fever. Some children become comatose as a result of progressive weakness and exhaustion. Cerebral edema, intracranial hypertension, retinal change, hemorrhage, peripheral and macular pallor, vascular staining and or macular edema, and brainstem features, abnormalities in position, pupil size and response, eye movement, or abnormal breathing patterns are commonly seen. Other systemic complications such as anemia, metabolic acidosis, electrolyte imbalance, and hyperparesia or hypoglycemia and shock are common. In deeply comatose patients with severe metabolic acidosis, shock, hypoglycemia, and current seizures, the prognosis is dire. Thank you.
Allow me to introduce myself. My name is Yohanes with the last three-digit number 089. A funduscopy is a physical examination that can assist in diagnosing cerebral malaria. Examining the eye fundus aids in the elimination of malignant retinopathy possibilities that are not caused by severe cases of malaria. The presence of retinal hemorrhage can be particularly helpful in diagnosing malaria due to their specific association with the disease. Funduscopy can be an examination tools to diagnose patients affected by CM because retinopathy caused by malaria has a different retinal characteristic. Furthermore, funduscopy is often used in challenging environments to diagnose CM. As a laboratory examination, peripheral blood smear can be done to check whether there are signs of a sexual stage of P. falciparum on the blood smear. The examination was carried out by testing thick and thin blood smears on slide using GM sustain at a magnification of 1,000 times. Some patients may not show any sign of asexual form of P. falciparum in blood smears caused by previous use of antimalarial drugs or infected blood sequestered in circulation in the brain. Therefore, it is necessary to carry out blood smears examination at least 3 times with a time difference of 6 hours. CM can only be said to be negative if all 3 tests are negative. PCR and antigen checking, namely rapid diagnostic tests, can also be carried out to diagnose. A cerebrospinal fluid examination also needs to be done to sort out other causes of encephalopathy. In general, cerebrospinal fluid appears normal in patients with CM. However, a slight pleocytosis was found, namely 10 to 50 cells per millimeter cubic, and an increase in protein level of 200 mg per deciliter.
Hello, my name is Yanti Graciella with my last 3-digit name number is 162. I will explain the next part. Differential diagnosis. The differential diagnosis elected by the symptom of fever are very broad. Diagnosis also cannot be done instantly. This is because fever that occur in different areas, even though they seem to have the same symptom, can produce the different result. In 2017, data show that around 77% had malaria, 18% had enteric fever caused by bacteria, and 5% had other unspecific infection. Fever patients show feelings of decreased consciousness and seizure. In addition, differential diagnosis caused by viruses that can be taken into consideration are influenza infection, coronavirus, dengue fever, yellow fever, Japanese encephalitis, and hepatitis A or B. For diagnosis, bacterial causes are anthrax, murine typhus, rickettsiosis, Q fever, and also Yersinia pestis. Due to the large burden of diagnosis, doctor must have the sufficient experience to make diagnosis. Misdiagnosis will hinder proper treatment.
Let me introduce myself. My name is Bagus, Tresna, Indra, Putra, Pramana with the last 3-digit number 104. And now I will talk about the treatments for cerebral malaria. If cerebral malaria is not properly treated, it may result in neurological symptoms, a coma, and even a death. And it is imperative to start treatment for cerebral malaria as soon as possible and has to be admitted right away to intensive care unit or ICU. The anti-malarial treatment of choice at the moment is artesunate and has to be given for 24 hours in intravenous dose, and should be given to patients with severe and cerebral malaria. There isn't a medication that is brain-specific besides intravenous artesunate. The sole option for treating organ symptoms and cerebral complications of Plasmodium falciparum malaria is symptomatic treatment. Respiratory assistance and artificial ventilations are essential despite being scarce, and with patients with seizures can be managed with benzodiazepines to reduce the risk of secondary neurological damage. And since cerebral malaria is a multi-process illness, focusing on a single signaling route might not be enough to lower mortality or improve neurological symptoms in cerebral malaria patients. And as a result, adjuvant therapy focusing on a variety of cerebral malaria physiological systems is required to enhance clinical results, lengthen survival, and lessen brain impairment in survivors.
Okay, hello doctor. Let me introduce myself. My name is Michael Jonathan Raya with the last digit name number 182. And now I'm going to explain about the complications and prognosis of cerebral malaria. So cerebral malaria itself is a severe form of malaria. Well, there are further complications that could be manifested by this condition. One of the most common complications caused by cerebral malaria is neurological dysfunction. It is a part of multisystem dysfunction. While Plasmodium falciparum, one of the 4 species of human malaria parasites, is the primary cause of all deaths and neurological complications. Clinical manifestation of neurologic dysfunction could also be seen in children is seizure. In addition, it also may be the cause of passive resistance to neck flexion. Besides neurologic dysfunction, cerebral malaria also could cause convulsions, hypoglycemia, and hyperpyrexia. People survived from cerebral malaria have increased risk of having neurological and cognitive deficits. Cerebral malaria causes multiple organ diseases. Besides, prognosis is worsened if patient suffers from systemic complications such as anemia, metabolic acidosis, electrolyte imbalance, hyperpyrexia, hypoglycemia, and shock. These complications should be treated soon for good prognosis result. Biomarker examination believed to be useful also in detecting malarial emergency. And coma acidosis malaria score is also found useful to improve prognosis. In conclusion, the prognosis of cerebral malaria often depends on the management of other complications. And that's all from me. Thank you.
Okay, everyone, my name is Putu Nirajanari, and the last 3 digits of my student numbers are 049. I'm here to explain the prevention of cerebral malaria. So, in general, the prevention of cerebral malaria is no different from the other malaria disease. The first one that we can do is vector control. So, there are various intervention methods that can be done to control malaria's vector. 2 of the most important are ITNS, or insecticide-treated nets, and IRS, or indoor residual spraying. The next one, we have chemoprophylaxis. Before traveling to malaria endemics, area, important to consult to a doctor for tourists before to determine the appropriate chemoprophylaxis drug to reduce the risk of contracting disease and transmitting parasites. And then we have chemotherapy preventive, the use of drugs such as antimalarials in combination or maybe personally to prevent infection and consequence of malaria is important to the population in endemic area. And then the last one, we have vaccination. In 2015, RTS vaccine, which is a first generation of malaria vaccine, was introduced to inhibit bacteria in infecting the liver or in the stage of pre-erythrocyte, which is the origin of the disease that occur. So that's all the prevention that we can do. The next slide will be presented by my friend. Thank you.
Thanks for the opportunity. First, I'm going to introduce myself. My name is Sienny Kuswardi with the last three-digit number, the number is 004. Now for the conclusion. Cerebral malaria is the most serious neurological complication of Plasmodium falciparum malaria infection, which may induce coma and death. The primary clinical symptoms of cerebral malaria include altered mental status, coma, and the presence of asexual Plasmodium falciparum parasites on peripheral blood smears. Artesunate is the first choice drug for patients with cerebral malaria, since it has the quickest parasite clearance rate of all antimalarial drugs. Since cerebral malaria is a neurologic emergency needing immediate treatment, we suggest further research and development on rapid diagnostic tools and biomarkers of cerebral malaria so the treatment can be more effective and efficient, thus improving people's quality of life. That's the end of our presentation about cerebral malaria. Thank you for listening. Stay safe and stay healthy.